Good afternoon, everyone. Very welcome to all the viewers and followers of our YouTube channel and Facebook followers. Thank you very much. My name is Fahad Ahmed, and we are live from Prime Health. A very, very important topic that we are going to talk about today is what is the ABCS of heart health. We're going to talk about a very special organ of the body, our heart, and we are going to know today what is the ABCS of heart health. When you talk about ABCS, I would really like to say here A for aspirin when appropriate, and B for blood pressure control, whereas C for cholesterol management, and S for smoking cessation. I have a very special guest here today with us, Dr. Saurabh Arvind. Doctor, welcome to the webinar at Prime Health.
Thank you.
Thank you.
So
Thank you very
much for
much.
inviting
Just
me.
wanted to introduce the Dr. Saurabh is the specialist cardiologist currently practicing at Prime Specialist Medical Center, King Faisal Branch, Sharjah, and with a good experience of 5 years. And he has a lot of expertise. Some of that includes blood pressure management, cholesterol management, and of course, all of that is connected to your heart health. Dr. Saurabh is going to talk about ABCS of heart health, all you wanted to know about heart health, how we really look into things, how we can really have a healthy heart, and how we can really live a healthy lifestyle. Dr. Saurabh is going to talk about all that today. Doctor, once again, thank you very much for joining us. Doctor, starting with our live session, as our topic says, we are going to talk about the ABCS of heart health, as I explained what is ABCS. And I would really like to, request you to elaborate this. And if you can just let us know the screening for lifestyle risks of cardiovascular diseases, if you can just collectively, please.
Yeah. Well, good afternoon, everyone. Thank you so much for inviting me. As rightly said, the ABCs of the heart: the aspirin, blood pressure, cholesterol, and the smoking cessation. While three are friends, while three are four, one is a friend. I would like to keep aspirin at the last because it's a very controversial theme right now. And we'll start with the blood pressure. Blood pressure, as we all know, is amongst the major silent killer of the body. Most of the patients will have high blood pressure, and yet they will not know it, while it will start causing damage inside. The blood pressure, as we all see, has a incremental value to the risk, wherein every 10 millimeters mercury increase in blood pressure, that is say from 120 to 130, there's approximately 3% increase in the risk of having heart attack or either a stroke. If your blood pressure increases from 120 to 140, that doubles your risk as compared to a blood pressure of 120. Most of the talks nowadays, most of the people feel that a blood pressure of 140 by 90 in old age, or even a blood pressure of 150 is acceptable if no one is having any side effect. While that is true that patient don't have any effects, the damage caused by the high blood pressure goes on increasing inside your body. It affects your brains, it affects your kidneys, it affects your eyes, it affects your heart, and ultimately you can have either a kidney damage or changes in the eye or a brain hemorrhage or ultimately a heart attack. So blood pressure control is very important, is very integral part of our management of risk for decreasing the risk of future cardiovascular events of having a heart attack. The cholesterol has been always considered a very important risk factor for having a heart disease. Cholesterol traditionally has been divided into a good cholesterol and a bad cholesterol. Most people consider that HDL is a good cholesterol and LDL is a bad cholesterol, and very little people know about the triglycerides. So I would like to elaborate that also. While LDL is considered a bad cholesterol, what we have observed that 50% of the patients who have a heart attack, they don't have increased LDL at the time of their admission. So even then they have a heart attack. Why is it so? It is because even if we have a normal LDL level or a normal cholesterol level, it is the quality of the cholesterol that is more important. There is something called as oxidized LDL, which are more prone to develop heart attack, which are more prone to develop kidney dysfunction, and which can cause more chances of of the cholesterol, which is more important. and that's why people will have normal cholesterol and yet they can have a heart disease. The triglycerides are is often like, it's a the ignored third brother of the cholesterol, which people usually don't tend to give more importance to. But triglycerides, if high, they have increased risk of patients having heart attack. So we have to take special responsibility for us to have the triglycerides in the normal range. The third thing is smoking. Smoking cessation is the cornerstone of a management for a patient who has any kind of heart disease. Smoking even two cigarettes for even say 2 days in a week increases your risk of having a heart attack by approximately 50%. And if you are a chronic smoker, if you smoke say 2 or 3 cigarettes for 5 days in a week, considering the weekend is off, that doubles your risk of having a heart attack. Smoking has effect not only on your heart, but it also affects your lungs. It has led to increased chances of cancer of all sorts and increased effect on heart attack. It increases the blood pressure, it increases the bad cholesterol, it increases the heart rate, all of which leads to more chances of you of suffering from a heart disease. Smoking can and should, and we must try hard to stop it whatever happens. Nowadays there's a lot of hoopla about the vape, that is the e-cigarettes. Most of the people consider that e-cigarettes or vape is safe. Let me tell you that e-cigarettes are not at all safe. In fact, e-cigarettes contain pure nicotine to the range of approximately 1,000 times more than a normal cigarette, and the pure nicotine has effects, profound effects on your heart. It causes a significant increase in your heart rate, in your blood pressure, as well as it increases the oxidation risk, which can lead to a heart attack. If you decrease cigarette consumption, if you stop your cigarettes, okay, the risk of having a heart attack decreases immediately. However, for you to have a risk level to that of a normal person who has never smoked, it requires at least 5 years of a smoking cessation for you to reach in the normal range. That means if you smoke even a one cigarette, your risk increases considerably for the next 5 years to have a heart attack. Now coming to the aspirin, I think aspirin has been used. We have been using aspirin traditionally as a blood thinner to decrease the risk of heart attack in patients who already had a heart attack or a stroke, and also for patients who don't have a heart attack but who are at increased risk of having a heart attack. There's been a lot of controversy about the aspirin use in for primary prevention, that is in patients who do not have a heart attack yet but who are at high risk, because primarily being a blood thinner, it leads to bleeding complications. And yes, there have been some incidences of patients having life threatening bleeding because of aspirin use when they did not have any of the heart diseases. We have a standardized formula, a standardized calculator for measuring the risk of the patients who have increased risk of chances of development of heart attack or any other stroke disease in the future, which can be used to reduce the risk of the using aspirin. However, aspirin use is not without any risk, and we have to be very careful about the use of aspirin in primary prevention, that is in patients who do not have any heart attack or any heart disease or any stroke at present. Considering all the things and too much controversy, I usually tend to give aspirin to my patients who at least have a smoking history, who have a family history, or who have a high cholesterol or a diabetes. In this patient, the benefit of aspirin far outweighs the any bleeding risk that is associated with the use of aspirin, and is very helpful in reducing the future events of the heart attacks. Considering now coming to the part wherein we need to find the various markers or various tests to find who are at high risk of future events, or screening part, I think we have few tests available, like doing regular checkup for cholesterol levels, Having high cholesterol level, either the LDL or low HDL or high triglycerides, will lead to a significant increase in the risk of future events, and therefore checking our cholesterol level every yearly or 2 yearly after 40 years of age, especially if you are a drinker or a smoker, and if you have a family history, is really important. Another important test or another important marker that we can find for predicting the future events, if you don't have anyone right now, is a HSCRP, that is high sensitive C reactive protein. It's a test which help us estimate what are the risk of you developing a event like a stroke or a heart attack or a kidney failure in next 10 years. If the value is of HSCRP is high, that is more than 3, we can try to reduce the risk by giving some drugs, and which have been found useful. Another marker that can be used to predict the risk is a lipoprotein A, that is basically a component of a cholesterol which has been associated with oxidized form of the LDL, which is a bad form of LDL, and it helps us to detect especially those patients who are at risk, who have a normal cholesterol level or normal LDL level. Using this all this test along with finding the high risk population can help us in decreasing the risk by starting the interventions like regular exercise or starting drugs, starting the patient who are at risk of development of diabetes in the future events will help us definitely in reducing the risk the individual will have of reducing the cardiovascular disease.
Thank you.
Yeah.
Thank you very much, Doctor. Doctor, coming to the next question.
Yes.
First of all, thank you so much for explaining in detail about the ABCS of the heart health. What is the role of physical activity in the prevention of heart disease, I should say? And of course, I would request you to also tell what is the role of tobacco cessation. And I believe you've already answered that in the prevention of heart disease. Still, if you can just elaborate more.
Of which one?
Of tobacco cessation.
Sorry, I couldn't get you.
If you can just first answer the question, what is the role of physical activity in the prevention of
Yeah, so like physical activity, any form of physical activity for any amount of duration is beneficial for a heart. Even if you can walk for 5 minutes in a day, that is beneficial to your heart. Even if you can do it for 2 minutes of brisk walking, small steps, that is goes a great length in preventing the risk. What we usually recommend and what is really good for the patient is that we start with a small duration of exercise, maybe say normal walking initially for 15 minutes, 30 minutes, 45 minutes, 1 hour, according to our capacity, and then gradually increasing the speed to brisk walking, which is like approximately 5 kilometers speed of a 5 kilometers per hour, to for a duration of 30 minutes, which will be helpful in reducing the risk. Small steps, small measures like parking our car at a slightly more distance from our offices or taking stairs instead of an elevator whenever possible. That also adds to significantly helps in reducing the risk. Planning our activities so that even if we are able to do some form of physical activity for 5-10 minutes, especially after taking a lunch or a dinner, that also is really helpful. If we do exercise, say if we do 30 minutes exercise for 5 days in a week, that approximately reduces your risk of having a heart attack in the future by half. So there's a 50% reduction in risk. And if we do the same amount of exercise for say 45 minutes to 1 hour along with some weight training, that will help reduce the risk of you having future events by approximately 3/4. So that's a very significant risk. There's a way too much benefit of doing exercises, and any form of exercise for, like I have already mentioned it, any form for any amount of duration is very, very helpful. It helps bring your sugar under control. It helps in bringing your cholesterol under control. It helps in increasing your good cholesterol, that is HDL. In fact, exercise is the only way to increase the good HDL, and no other medication works like a good exercise. It definitely is the best way to reduce your risk.
Thank you, Doctor. Doctor, what do I need to know about high blood pressure? And what is the link between cholesterol and heart disease?
Yeah, like already mentioned, every 10 mm increase in your blood pressure, say from 120, to 130, or say from 130 to 140, will increase your risk of having a future event of like a heart attack by 3 to 5% every 10 mm increase. So even if we consider that a normal blood pressure is of 130, if our blood pressure is 140, that increases the risk, that puts you at a higher risk of having a blood pressure, that puts you at higher risk of having a heart disease, of having a stroke, or having a kidney disease, or having an eye disease. Keeping the blood pressure range as low as possible is the preferred way now to go, instead of keeping it say around 140 or 130. There are various ways, there are various methods to reducing the blood pressure. The tablets are our last options. First and foremost is proper dietary control along with regular exercise. Most important is salt restriction. Decreasing sodium intake helps in reducing your blood pressure. Decreasing the consumption of oiled foods, the canned foods, helps in reducing your blood pressure. Increasing the consumption of potassium in your diet, like say a coconut water is very rich in potassium, banana is very rich in potassium, that helps to reduce your blood pressure. Doing regular meditation or any relaxation activities like yoga, or listening to music, whichever helps you relax, that goes a long way in reducing your blood pressure. Tablets definitely are helpful. Tablets definitely are used and should be used if we are not able to achieve a proper blood pressure control, but they should be our last resort. I think most of the people also ask us about whether if we start a medication for a blood pressure, should we stop or will we be able to stop it? I think the answer to that depends on how good you are with your exercise activity, how good and how strict are you with your dietary regulations, how good nicely you follow your dietary advice, and if that is maintained, how much you lose your weight over a period of time, we can definitely stop the medication, and if not stop, bring it to a minimum where possible.
Thank you very much, Doctor. By the time I've got a lot of questions coming in live from people, Miss Anita is asking a question, and I would really like to ask you that: are medications mandatory for high triglycerides?
Again, like I said, the medications are usually our last resort. If the we have a very high triglycerides level, say more than 500, you would like to start immediately on medications to reduce the triglycerides level, because that kind of triglyceride level is associated with chances of having abdominal pain because of pancreatitis as well as heart diseases. So anything less than 500 and above 150, you can definitely give a trial of exercise and proper dietary control, like reducing fat consumption, reducing all kind of canned foods, reducing all kind of carbonated beverages, reducing your all kind of sweet beverages and alcohol consumption. That can definitely go a long way, along with the regular exercise, weight loss. If we have diabetes or if we have thyroid, all this can cause triglycerides to increase. So proper diabetes control and bringing thyroid under control, all those can help in bringing triglycerides level to normal. But if it doesn't come to normal despite this, or if those things are not possible, then we would definitely like to start the patient on medication, because benefit of starting a medication is way too higher than the side effects.
Thank you very much, Doctor. Another question from Mr. Rafiat. He says, my husband has a bit of high blood pressure and they're monitoring it. And the doctor told not to be worried about it, but often it's higher, for example, 140 by 90. Should he start the medication?
Yes, I think if you have given a trial of of dietary restrictions, of exercise, of reducing salt in your diet, then and the blood pressure is above 140, I would recommend that you start a tablet, and also along with tablets, we will continue to work harder on the exercise regimen, to weight loss, for salt restriction, and try to stop the tablets. But like I have already mentioned, every 10 mm increase will have has an incremental risk of having development of blood pressure and its side effects. We would definitely like to start a treatment in this case.
Thank you, Doctor. Thank you very much. For another question, Dr. Asta is asking, what's better, lipid profile with LDL or calculated LDL?
Okay, so the best is the calculated LDL formula is fairly accurate, till the triglycerides level are less than 500. So if you have a triglycerides level which is less than 500, the calculated LDL formula is very accurate, and we don't need an extra test for LDL calculation. However, if the triglycerides level, that to a fasting triglycerides level, are more than 500, the Fridwell's formula that is used for measurement of LDL, that goes completely haywire, and then we would need to actually directly measure LDL.
Thank you. Another question coming in. The question says, one has normal BP, exercises every day, non-diabetic, non-smoker, but elevated cholesterol. Needs to take cholesterol medication?
See, again, depends on what exactly is the cholesterol level is, what is the LDL level, what is the HDL level. We need to calculate the risk of you having a future events. We have a calculator developed by the American Cardiology Association, which measures the risk of having cardiac disease according over that for the next 10 years. We need to measure that. That includes like smoking, that includes even your family history. What is your weight? Was there any alcohol intake? What is your systolic blood pressure? What is your diastolic blood pressure? So all these factors are taken into contribution. All the factors are weighed, and accordingly we get a risk estimate of you having a disease in next 10 years. And if that risk is say more than 7.5%, we would like to start you on a cholesterol lowering measure statin, that is statin, for next say at least 3 to 6 months. See what is the cholesterol level, and then accordingly take a call.
Thank you, doctor. Thank you so very much. Uh, Doctor, any particular oil we can use to cook food to keep BP in control?
I think instead of oil for the blood pressure control, we do have some like oil, the canola oil, that is preferred because of its higher content of the non-saturated fatty acids. The extra virgin olive oil is also good because it contains less amount of the saturated fats which are bad. But per se for blood pressure reduction, there is no oil consumption that is required. Restricting salt is important, and the oil will help out in the cholesterol management.
Thank you, doctor. Just following up, followed by another question which is related to this: are cold pressed oils better than the refined oils?
Yes, because the refined oil contains high amount of saturated fats which are bad for our health. The refined oil contains high amount of vegetated oils which are marinated oils which are bad for our health. So the cold pressed oil are comparatively better. We don't have any as such very reliable studies which have demonstrated the benefit of cold pressed oil as compared to the refined oils, but we do have lots of study and research about the refined oils that they are not particularly good as compared to this one. So yeah, the cold press can be preferred.
Doctor, any is there any recommendation for a healthy oil that you can do? Also, is it a good idea to switch oil often?
Yeah, so the like I already mentioned, the canola oil is preferred. It's comparatively preferred, not the preferred one. We cannot recommend any one oil because we don't have any definitive studies. But yeah, the canola oil is preferred. Olive oil is preferred. It is very actually difficult to cook sometimes in olive oil, but still, if you can use a olive oil and canola oil. And regarding there was a study with there was some studies, and there was some association where it was found that changing the oil frequently, say every 2 or 3 months, can help get us benefit of all the kinds of oil while keeping the disadvantages to the minimum. So that also can work. Like I said, it doesn't, not one spoon doesn't fit everything, and we may have to find everything. We may have to find different alternatives for everything, but mostly using a canola oil, and this is a preferred one.
Thank you, doctor. Thank you very much. Doctor, a very important question I believe that has come up from Dr. Deepak here, saying, asking, what are the effects of COVID-19 on heart?
Yeah, so it's been a like because COVID-19 leads to increased tendency of the blood to clot. We have seen patients who are having higher incidences of heart attack because of blockage of the arteries due to that blood clot. Patient also have higher incidences of pulmonary embolism, that is basically blockage of the arteries of the pulmonary arteries, which leads to increased pressure of the right side of the heart, and it leads to a right sided heart failure. So basically, all those blood clot events leads to either more of a heart attack as well as pulmonary embolism. Also, there are the effects of these increased clotting events are present in the patient even after 2 or 3 months after a relatively milder COVID attacks, and patients then present after 2 or 3 months with a heart attack. That's also we have seen. There's also higher incidences of patients developing blood pressure and hypertension after the COVID. The cause as of now is not known to us, but stress level because of a COVID infection and because of increased blood tendency to clot is being leading to it. Yeah.
Thank you, Doctor. Doctor, before the session, we had some registrations and we've got some questions, so I would really like to ask a few of them. Mr. Sagar Ahmed has asked a question, and the question says like this: I saw many people looks healthy and fit, then suddenly we hear that they have got heart attack or they died due to cardiac
Yes,
arrest.
yes.
Is there a warning sign so that we can control it, or there is no way out?
I think most of such patients who have a sudden cardiac death, who are apparently healthy, they are not heart attack related, but mostly they are because of the electrical abnormalities in the heart. Those we are known as arrhythmic deaths. Most of the times we will not have any warning signs apart from maybe a family history of a similar event in father or in uncle or in some grandfather. That is the only way we can have some idea of risk of having arrhythmic events, that is electrical activity events. However, a few of those deaths are because of a cardiac arrest due to a heart attack, and most of the times we do have warning signs, like patient may have a small episode of a chest pain which he may have ignored, a small episode of some sweating, or a small episode of loss of consciousness or palpitations or dizziness which was ignored or which was ascribed to some normal condition. And but yeah, it can be predicted in most of the, if we have a normal levels of the sugar and normal levels of cholesterol, at most of the times we can predict and of the occurrence of such events in the patients.
Thank you very much, Doctor. I've got another question here, and the question says from Ms. Lavi, and she's saying if cholesterol is within normal level with medicine, we should continue medicine every day.
Yes, see, that again depends, like I have said, on the what is the other factors like hypertension, like diabetes, what is your age, what is your like, is there any smoking? That depends on that. So we considering all other things, if your blood pressure, if your cholesterol remains normal with the medication, it is normal because of the medications, and we can actually give a trial of starting the medication alternate day. That is one of the way of reducing the dose of the medication. We can give a trial of using it alternate day and see and repeat the cholesterol level after 2 or 3 months, and if it's within normal limit we can continue it that way. But more often than not we need to increase it back to the daily, because the cholesterol dose required is actually high and we need to maintain the daily dose for reduction of cholesterol.
Thank you. Doctor, a lot of people are concerned about the food. That's the reason a lot of information is
Yes,
being
yes.
asked actually for oil. I've got another question here in regards to pure ghee that we say. Is good for health? True or false, doctor?
The pure ghee, I think anything in excess is bad. So if you are consuming it in a moderation, it is not bad, I would say. Definitely not good. It is neutral, maybe.
Yeah. Doctor, now talking about some places, do cold places have more effect on cardiac system? I mean, chances of heart attack? This is a question from by Mr. Afia.
Yes, actually, the cold during cold time, there's increased vasoconstriction, known as that is a normal adaptive response. Basically, that is decrease in the size of the arteries because of cold to increase the warmth feeling, and that can have a increased effect on chances of heart attack because of decrease in the size of the arteries. But it is very low as such, as compared to, say, the effect is very low, but yes, some effect is definitely there.
Great. Thank you. Thank you. I would like to ask another question that came up from your registrations. The question is from Mr. Jagdish, and he says, does daily walking improve one's cardiac fitness, even if it is relaxed, leisurely walking for 45 minutes?
Yes, definitely. Like already he mentioned, even 5 minutes walking, doing nothing is doing something is better than doing nothing. So even 5 minutes of exercise is beneficial. Of course, if we can do a brisk walking, that is more useful and more beneficial than compared to the relax activity. Yeah, but 45 minutes of relax activity, I think if you can split it and do 5 minute brisk walking in between, say after 15 minutes, initially 15 minutes, then 5 minutes brisk walking, then normal activity, then again 5 minutes of brisk walking, that would be more beneficial and more useful and wouldn't tire you that out that much.
Thank you, Doctor. Dr. Mohammed Naeem Bhatti has asked, uh, I feel sometimes pain, chest pain.
Okay.
I do all the heart tests. It's okay, every time. Can you please tell me what else issues? What is the problem of what is the reason of this pain that is coming up?
Okay, so chest pain is a broad term. So chest pain includes the reason for it are plenty of it. The heart is just one of the reason for chest pain. We are very much worried and very much frightened about having a heart pain or chest pain because of a heart condition, because that can be life threatening. But in more than 90% of the cases, the chest pain is not heart related, it is non cardiac. It may be a muscular pain, it may be because of acidity, it may be because of some bone involvement, the ribs involvement. At times, it may be because of some nerve involvement. And so, yeah, so not all chest pain are cardiac pain, but it is really important to rule it out once so that we are very sure that it is not related to heart.
Thank you very much, Doctor. Uh, Doctor, moving on further, I would really like to ask you, Doctor, if my body makes its cholesterol, why does my diet matter?
Yes, because whatever cholesterol your body makes, it is the one which it can use, which it requires for normal functioning of the body, and which is in a form which is easily metabolized by the body. Whatever cholesterol that we eat in the diet, that is usually a complex one. It takes lots of efforts on the body to uh, hydrolyze it, to metabolize it to a normal form, most of time which is not possible, and therefore all the excess cholesterol that is comes in the diet, that gets deposited in all the parts of the body, and which basically leads to all kinds of issues.
Correct, Doctor. Doctor, we can see nowadays having there are some tablets which are not actually medications, but just like the vitamins. Tablets are there for cholesterol. What do you recommend? Should a person regularly take those tablets with the food, just not as a medicine, but just like a person takes a vitamin tablet?
I think they are talking about the omega 3 fatty acids, the MUFAs and the PUFAs. There has been lots of the hula in the social medias about the omega 3 and omega 6 fatty acids as a measure to reduce cholesterol level, especially triglycerides. Uh, while they are helpful, they certainly are. They basically are derived from fish oil. I think they are helpful in reducing the triglycerides as well as cholesterol levels. And if there are no significant side effects, they can be tried. But again, the benefit of other tablets, which are if you have a high cholesterol, the benefit of using atorvastatin or statin is much greater than using these fish oils, the omega 3 and omega 6. So if everything is normal, you can definitely use as a supplements to keep the cholesterol level low. But if you do have a high cholesterol, this can be your primary treatment.
Right. Thank you. But we can add it.
Yeah, we can definitely add it, and you can take it as a supplement. I don't think there are any major side effects apart from frequent abdominal bloating. That's it, I think.
Thank you. I've got some more questions coming in. A lot of people are interested in asking the questions. I'll take another question. Mr. Muhammad is asking, Doctor, is beetroot juice good for blood flow?
The beetroot juice actually contains high amount of iron, I think. Sorry, the iron, which is good in improving the hemoglobin level. So it is useful that way. Per se, for increasing the blood flow, I don't think there is any significant benefit in that. But it can be, it should be used. It can be used, considering that there are no side effects as such. The sugar in the beetroot juice is quite modifiable, and it can be consumed easily even in diabetics, I think.
Thank you.
Yeah.
Doctor, a quick and short answer I would like to take from this. Ms. Ulasini, pardon me for the wrong pronunciation of the name, is asking, please tell me the emergency first aid for heart attack victims which we can do.
Yeah, first and foremost, if you find anyone who has a severe chest pain or anything, call for a help. That is the first important thing. The sorbitrate tablet, it is like very easily available. I think every most of the heart patients carry it. If we can give that tablet to the patient to just keep it under the tongue, that can be life saving. If aspirin is available, that can be given. That is life saving to such patients. Calling the ambulance as early as possible, keeping the patient comfortable, just ask him to lie down. He should avoid any kind of activities. That would goes a great way. If patient has a heart arrest, cardiac arrest, we can start with the chest compressions till the time we have some help. That can go a long way in this.
Thank you. Doctor, moving on the next question, is having aspirin at home recommended?
If having said, that depends, I think, on most of the things, like what is your age, what are the risk factors you are having. So it's recommended. I don't think it is recommended. Can you keep it at home? Yes, you can. And if you have any chest pain, or then you can definitely take it. But as such, I don't think I would recommend my patients to have aspirin at home unless they have anything really. They're at high risk of a heart disease.
Absolutely, absolutely. I've got a very interesting question here, doctor. What is the role of pets in bringing down stress levels? Asked by Dr.
What is the role of
pets in bringing down stress levels?
Okay, so yeah, so dog and cats.
Yeah, exactly.
Yes, so they are really helpful. Like they give us a sense of belonging, and they give us a sense of happiness, which I think we can get sometimes. And they, yes, they help, certainly help in reducing the stress level. They help in reducing. They give us a happy time. They give us a joyful time, and they have a role. They certainly can be helpful if one finds the pets to be this likeable.
Thank you, doctor. Another question from Mr. Malanati. A patient with diabetes, hypertension, and obesity with hypolipidemia requires statin?
Yes, they do, because like already mentioned, the cholesterol level is not the only thing. Absolute cholesterol level is not the only thing. The LDL level that leads to heart attacks. Like already mentioned, approximately 50% of the patients who have heart attack will have a normal cholesterol level. It is the quality of the cholesterol, the quality of the LDL, that oxidized LDL, which is important. So if a patient is at high risk, like if a patient has a diabetes, is a smoker, has a blood pressure, is on medications for them, definitely they need statins, the cholesterol lowering drug, to maintain the decreased level of those oxidized LDL. And apart from reducing the cholesterol level, the statins, that is the lipid lowering drugs, also has a effect on making whatever the cholesterol is there in the blood vessels, making them more stable, thereby reducing the chances of heart attack.
Thank you.
So yes.
Doctor, question says by Ms. Deepa, what advice will you give for people who have exercise-induced cardiac arrest?
Yes, so we need to first find a cause for patients who are having a exercise induced cardiac arrest. Most of the time it is because of a electrical abnormality in the heart, like already mentioned, that is known as arrhythmic one. So in this case, avoiding the exercise is the treatment, is the one of the ways of going ahead. Of course, this patient needs an ICD, that is a implantable cardiac defibrillator. That is basically a small machine which is placed inside the heart, and which will give a current to decrease or this whenever the patient has these events. And that is the one way. However, if patient has a cardiac arrest because of a heart attack or because of a coronary artery disease, treating and putting a stent or doing a bypass uh, as a treatment, and then patient can definitely restart the exercise. So it basically depends on the cause. If it's an arrhythmic one or electrical one, they should avoid it and put a ICD.
Thank you so very much, doctor. Another question from Mr. Birdseye. I believe this is a very good question. Can you define stress? A lot of people are unable to understand what they are doing is stress or a regular activity.
Okay, so I think a little bit of a philosophical question maybe, but yeah. So stress, anything that will cause you discomfort is a stress. Now the discomfort could be in any way. Maybe you will not get a good sleep. Maybe you will have a headache. Maybe your heartbeat would be on the higher side. Maybe your blood pressure would be on higher side. Maybe you will have a indigestion. So anything that can cause you any form of discomfort, we can label that as a stress. It could be a physical activity like working too much, working during sun in a sunlight, exposure to a sunlight. That is a physical stress. It could be a emotional stress, going through some emotional work. It could be a work related stress because of some tension at the work. So it could be any form of stress, and whatever that causes discomfort to you.
Thank you very much, Doctor. As we are moving towards the end of the session, I would just like to ask you another question before we end up. I've got a question here, Doctor. How we can differentiate chest pain related to heart or gas pain?
Yeah, okay. So that's an important point. Two things. First, the chest pain due to heart can be because of a heart attack. In that case, it would be a really unbearable chest pain, and you would see there can be lots of perspiration. You would sweat a lot. You can have some visual disturbances. You would not see clearly. There will be visual blurriness. You will pass out because of that pain. So all these things point towards more of a pain because of a cardiac cause. The pain of acidity, usually it will be more after you have a food. The pain of acidity, usually it would be more in the stomach area rather than on the left side or the or the shoulder. And usually it would be relieved after some activity, or like after you start walking, the pain would be reduced because of acidity, while that of a chest pain will increase because if it's a heart one.
Great, thank you, Doctor. Doctor, I would really like to ask last question before we end up the session. What is the role of added sugars and low-calorie sweeteners in the prevention of heart disease?
So the low calorie sugars, they can be tried as an alternative to the sugar sweetened beverages like the cold drinks, like the soft drinks. They can be tried as an alternatives to them. Any form of refined sugar is bad. The normal sugar that we use in our day-to-day whole, that is a refined sugar, so that is bad. So we can try a low calorie sugar. Even saccharin can be tried as an alternative. They do have their side effects, and they do have their ill effects, but certainly they are better than the refined sugars. They are certainly better than the sweetened sugar beverages that are available in the all the most of the liquid that is available.
Thank you very much, Doctor. I've been requested to ask questions, a couple of questions related to registration that has come up here. I
Okay.
would really like to ask you those questions, Doctor. Yeah, the question is from Mr. Habib Hussain. After one angioplasty, is it mandatory to continue lifelong medication?
So if the angioplasty has been done, that means you had some disease, you had some blockage, and you are placed a poor instant. So yes, you have to take at least aspirin for lifelong, and cholesterol lowering drug, that is statin, not for the cholesterol purpose, but because like I said, it has a stabilizing effect on the cholesterol already present. So those two drugs must be taken lifelong. Yes, it is mandatory.
And Doctor, Mr. Rashid is asking, Doctor, which exercises are best for heart health?
uh Sorry. The exercise, the basically moderate intensity exercises. The moderate intensity means like anything, cycling, doing for cycling for half an hour, walking or jogging at a speed of less than 5 kilometers per hour. Those are beneficial. Those are which are the most beneficial effect. The weight training exercises, they are not that beneficial from the cardiac point of view, like the one which we help to build up muscles. They still have their benefit, but most of the time the cardio part, that is either walking, running, swimming, cycling, elliptical, all those things, they are the most beneficial ones.
Thank you. Doctor, is jaggery good alternative to sugar?
It is considered good as compared to sugar, but that doesn't mean that we go on consuming it without any restriction, but definitely considered better as compared to sugar. Again, we don't have a very uh, like say a very proven benefits or a proven data. That is a general consensus, but we don't have a very comparative studies of the both. But still it is considered that jaggery is better because it has got less processed, and the sugar content and it is less processed as compared to the normal sugar, white sugar.
Doctor, a very important question. Mr. Muhammad Ikram is asking, it's more of related to an addiction actually. I have to stop smoking. If I don't smoke, my hands will shake. I will upset and be in the angry mood. Please give me suggestion to avoid smoking.
Yes. So first and foremost thing in quitting smoking is like the motivation, I think, which you already have here. You have to be extremely motivated. You have to have a very strong will. We have plenty of drugs now available, the which will help you quit the urge which you will have to smoke. We have nicotine chocolates, chewing gums. We have nicotine patch that will help you with the withdrawal symptoms. We have drugs that is varenicline and duloxetine, which can be given, which can be prescribed to you, which helps in quitting smoking. And you should consult a doctor near physician nearby. They will definitely help you with it.
Thank you, doctor. Doctor, is there any other treatment without bypass surgery or angioplasty for blocked arteries, diagnosis and disease? This question has come from Mr. Fadl Abbas.
It depends on what your symptoms are and what exactly the location of the block is. There are some, if it is not amenable to, if the we cannot do a bypass, if we cannot do a angioplasty, and if you have symptoms, there is something called as EECP, that is enhanced external counter pulsation, that can help you with the symptoms if you have symptoms of chest pain or any breathing problem because of that. So that is one alternative. Continuing only on medications, that is another alternative. But apart from that, no other viable alternatives are there.
Thank you, Dr. Saurabh. If we are going to continue the session, the questions will keep on coming in.
Yes.
Thank you so very much for to all of the audience who have appreciated, Doctor. I just want to tell you, a lot of people have appreciated your session,
Thank you so
your
much.
answers. I just want to thank everyone for watching us today. Doctor, what is, before we end up the session, what is the take-home message that you will give for a healthy heart?
Yes, I think the most important thing is regular exercise, a proper balanced diet, keeping the consumption of the fat as well as the sweetened sugars to a minimum with the regular exercise. Both of them are the cornerstone of having a healthy heart. Apart from that, taking proper regular medications if you have any blood pressure or cholesterol, and along with that a blood thinner like aspirin if required, that will help in preventing all the future events. And without any doubt, smoking cessation, smoking has no benefit, no, not a single benefit. It is the most harmful part of all the things that I can consume, and therefore it should be stopped at the earliest.
Thank you so very much, Doctor, for the wonderful session today. I just want to tell everyone, if you want to book an appointment with Dr. Saurabh Arvind, he's currently practicing in Prime Specialist Medical Center in Sharjah. And you can see the number floating at the bottom of the screen. That is 0470709999. You can book an appointment with Dr. Saurabh if you want to have an appointment with him. Apart from that, we would really like to have your recommendation. That is very important. Please give us a feedback with your reviews on Google Reviews or on Facebook page, which is Prime Health. You can always watch this live session on our YouTube channel, which is Prime, and here also after this live session is over. We would also like to tell you that if you have any questions coming in your mind, you can see the email at the bottom of the screen, myprime@primehealth.ae, and Dr. Saurabh will come back to you with the answers related to your question. And definitely, if it is required, we will ask you to come for a consultation. For more details, if you want to book an appointment, you can always refer to Prime Health Me app, which is available both in Android and in the iPhone, and you can definitely book appointments from there, and you can see Dr. Saurabh's details also over there. So thank you very much, everyone, for watching us. As we have really, Prime is all about personalized care, personally, that we always wanted to spread the awareness, and that's what we have actually discussed, the ABCS of heart health. And I believe this information, the session for today was very informative, and it was very important to all of us. And Dr. Saurabh, once again, you have given a lot of information today. Thank you so much for all the questions that you have answered patiently. And if any questions that are missed out, we apologize for that, because of the time limit we have to close the session. Thank you very much, everyone. We will be coming back to you with another important live session very soon. Take care. Bye-bye. Prime is all about personalized care personally. Thank you.
Thank you so much. Thank you.